Let's see. Let's see if I can get these slides up here. And alrighty.
And I can see that fine. That looks great, Amanda.
Okay, is it sharing? Can you guys see the notes section or the regular way?
I can see the slide view.
Okay. So that should be the way you should see. Okay, perfect. You never know with two monitors, sometimes it shares it correctly, sometimes it
I
does
know.
not.
Yes.
Well, good morning, and thank you for welcoming me to your Cup of Joe. I appreciate the invitation. My name is Amanda Waldrup. I'm the Deputy Regional Administrator here in the HRSA Regional Office. We have one in Chicago. That represents the region that you are in, that your state is in. So we have Michigan, Ohio, Indiana, Illinois, Wisconsin, Minnesota. That's our region, plus the 35 tribes that reside within those states. I'm not sure how familiar everyone is with HRSA. So the Health Resources and Services Administration, we're an agency under HHS. So everyone's kind of heard about CDC, but sometimes we don't do the best job of getting our name out. Although I'm sure once I tell you a little bit about some of our services, you'll be like, oh yeah, I definitely know what HRSA is because they do all of these things that I've heard of, but sometimes I think that they're part of other programs. So hopefully you walk away today with being like, oh yes, I definitely know what HRSA is. So HRSA is basically the access agency is how we think of it. So we provide services, probably the best known is through our community health centers, or sometimes called FQHCs or federally qualified health centers. And that provides services to more than 31 million people across this country. We also provide service to more than 58 million pregnant women, women and children, infants across this country. That's about 98% of all births. We provide some kind of service to those infants around this country. We provide service through our Ryan White program to HIV positive persons within this country. And we provide service whether they are rural or urban, tribal lands, also. So really large swath across the entire country. And then we are also doing a lot in the workforce area to provide for the next generation of those providers, because we know that there are going to be huge gaps in the provider workforce. So we're really trying to do our part to increase the amount of workforce that is available for the next generation. So I'll talk a little bit about that later as well. Okay, so we have four main priorities that we work with in HRSA. So our first is equity. So we want to spread equity within everything that we do in HRSA. We want to incorporate it into all of our policies, procedures, all of our programs, to really make sure that we are getting the care and services, putting our dollars in an equitable distribution across the country in a way through our programs. So the next is strengthen the well-being of children and families. So we put that and sprinkle it throughout all of our programs, but especially through our maternal and child health program. Then we have integrating behavioral health into primary care, because we know how hard it is for people to go and seek care. And so we don't want them to have to go here for one thing, here for another thing, there for a third thing. So if we can incorporate behavioral health into our primary care, so through our health centers especially, and we've done a lot of work in the past several years to incorporate behavioral health, substance use care into our primary care health centers, so that they can be a one-stop shop for people who need those services. So they don't have to seek that in several different places and several different appointments. And then grow in that health workforce, like I spoke about. This is just, again, some more of those stats that I told you about. One that we're really proud of is that through our Ryan White program, nearly 9 out of 10 people who are in our program who are HIV positive achieve viral suppression. So what that means is once they achieve viral suppression, they can no longer pass on HIV to anybody else through sex. And that is actually higher than people who are not in the Ryan White program, so outside of the program. So it's higher than the national average. So we're really proud of that because it's one of the ways we want to be able to get to zero and get to zero transmissions in the US. And then we have expanded our school-based health center program in the past 2 years. So people are being, again, able to get care where they are so they don't have to travel long distances. So we're increasing that school-based care. In terms of our maternal and child health, like I said 98, it's 97. Sorry, it was 98. Of all babies born in this country receive some kind of money through our maternal and child health program through like screenings for all those screenings they get like in their eyes and all that kind of thing when they're born. A lot of that is HRSA funded monies that is going to be able to fund all of those things. And then we're increasing the amount of birthing facilities around the country through some programs called AIM or Alliance for Maternal Health, and also working to help reduce the amount of maternal mortality, infant mortality in this country, because we know it is by far way too high, especially in Black and Brown communities around this country. It is far too high. So we're working on different ways, how can we help? What are some best practices? How can we help reduce that amount? This is something I don't know if you're aware of, but if you're not, highly recommend you can scan the QR code. After this, I can put a link in the chat directly to it. It's 1-833-TLC Mama, and there's free materials that are available. You can download, you can order some. They're available in English and Spanish. So they can call live, either call or text, English and Spanish, and then language line up to about 60 more languages. This is not the same as 988. So we do want to make that clear. That is a very big distinction between the work that 988 does and the work that the maternal mental health line does. This is not for that, serious person who is having suicidal ideation. This is someone who just needs some extra support. Maybe during pregnancy, after pregnancy, it could be the pregnant person themselves. It could be a concerned family member that calls. And this phone number will have same trained like clinical professionals, and it can link them to care in their communities if they need that extra support and additional services after the call. And then, so it is not the same as 988, but it is a resource that's available. It's free and it's available 24/7. So it is something that you can promote in your organizations to be able to give out if people just need some additional resources and additional support. So we do encourage you, if you don't have this resource and kind of, information that you give out to patients and things like that, we hope that you can get this information out to them. In terms of behavioral health into primary care, we are increasing the amount of substance use providers that are available in our health centers. Those are trained to use things like MAT, for example, especially in rural communities, because we know that that is such a need, and there's still such a stigma in being able to find care in rural areas. So we're really working hard to get our providers trained on that and being able to write scripts for those medications that are also important to be able to get into that recovery that people are asking for. Okay, growing the workforce. So we are doing a lot in this space because again, there's such a need. So we are working on our main kind of highlight program is the scholarship and loan repayment programs, which have been around for a while. And I'll go into those in greater detail, but we're also working with teaching health centers to try to get them to recruit more and to work in different areas. So we're adding additional funds in those areas to get them to be able to increase their capacity of how many students they're taking each year as well. Okay. This is my office. So all of that was some other things in HRSA. This is me, the Office of Intergovernmental and External Affairs, or IEA. And really what we do is things like this. So thankfully, I don't have to manage any grants. I don't have to come with any red pens or check boxes when I come out to see people. I don't have to have anybody kind of fear me, when I call. I really just get to come out when I do visits to any of our sites, or when I go to meet new people like yourselves, that maybe are not HRSA grantees. And I really just get to talk about HRSA and say, hey, do you know what HRSA is? Do you know any grant opportunities we have available that, you might want to apply for? I get to talk at conferences or things like this, maybe any events that we're doing, like grant writing 101s, for example. And I really just get to talk about HRSA. So we're really just kind of the ambassadors for them. And then we work in the region with our other HHS agencies. So SAMHSA, for example, maybe CMS or other agencies that are within HRSA. And we kind of work together collaboratively. So if you need assistance with another HHS agency, but you're not sure who to call, you can actually call me and I can try to connect you with them as well. These are just a list of some of our stakeholders in the region. You don't necessarily have to be a HRSA grantee to work with us. We're always willing to work with whoever's willing to work with us. And we're always interested in making new friends. I wanted to talk a little bit about the Bureau of Health Workforce because I know that workforce is such a huge issue, not only in your organizations, but also in ours and around the country. So we have an entire bureau devoted to just workforce. And this is probably not going to look very shocking to any of you. So this is what we are projecting as workforce shortages by 2036. We have behavioral health there in red. So we know that there is going to be huge behavioral health shortages. We know that there already is, but it's not, going to magically cure itself, right? Unless we do something about that. So we are trying to do things that are going to help reduce the burden of not only behavioral health, but all of these other areas, from OBGYNs to nurses. And some of the ways that we are doing that is making sure that people are knowing about our opportunities. And so we're increasing the supply of, who is going to school for these. And then the distribution of making sure that they, again, that equity piece, that they are in the areas that are most in need. These are some of the ways we're doing it. So we're also trying to make sure that we are recruiting from the communities that need these services most. Because we want to make sure, again, equity, we are giving people the opportunity to work in the communities that need them. So we want to make sure that people, look like who they're going to serve, have the cultural competency of who they're going to serve, speak the language of who they're going to serve, that really fit best the community, right? And we want to make sure we're giving opportunities to those communities as well. So we're really trying to work hard to make sure that those communities are not just left behind and we just send people in, to go help them, but we're actually working with the communities to make sure they know these opportunities exist as well, and then can help them afford to pay for those opportunities, because I know how hard it is to not know anything about, like I'm the first generation in my family to go to school, to go to college. So it's like you don't know what you don't know. And so you really need someone to kind of almost, hold your hand and walk you through like, no, this is how you apply for a scholarship. This is how you, apply for college. Like those kind of things sometimes is really helpful to have someone to kind of help you walk you through that. So one of the main programs that we have is the scholarship and loan repayment programs. And it's the National Health Service Corps, Nurse Corps, STAR LRP. That STAR one is just loan repayment. That's specifically for behavioral health careers. And that is a newer program, probably 5 years or so. And that again is just behavioral health, because we know we had such a need. And then we've recently added a pediatric specialty, because we know that there's such a shortage in peds. And so the way that this works is for the scholarship one, people would be able to apply while they're in school, and that helps them pay for school while they're in. And then depending on which program they're in, they guarantee us 2 or 3 years. Once they're out of school at one of our facilities, they get to choose. They get to choose where in the country they work. They get to choose what type of place they work. So is it urban? Is it rural? Is it tribal? They get to make those decisions. And then once their service is done, they've met their commitment, they can choose to stay. They also still get paid their normal wage, whatever they negotiated with that organization, say a health center. They still get paid whatever they have negotiated. So it's not like they work for free. And then with the loan repayment, they've already graduated. They have, however much debt they have. And then they work for us for that 2 or 3 years, again, depending on which program. Nurses is like 2 years. The others, kind of like a medical doctor, would be 3. And then after those, they can re-up if they have more loans to work, I think, an additional up to, I think, 6 years. And then after that, they are free to leave if they'd like, but a lot of them choose to stay. And they still get that same salary, what they've negotiated with that organization. This one is the only one that's open. And this one is for um, the National Service Corps, and it's a scholarship one. It is for the last year students, so like medical doctors, midwives, those kind of. It's the only one that's open currently, and it's open till November 7. When you get the slide, you'll be able to click on it. So if you know anyone who's interested and wants to apply, you'll be able to click on these. But you can see they open fairly often. It just depends on what funding is appropriated from Congress. But you can also subscribe at the little link down there. So if you are interested, you can also become a site. So if you're interested in having any of these groups come and work for you on your site, you can apply to be a site, and then you would be able to get some of these scholarship or loan repayment persons at your site. So I encourage you to sign up so you don't have to go back and check every week, every month kind of thing. It'll just email you and say, hey, this is opening up, please apply. So it makes your life a lot easier. This is what it looks like in Indiana for the 2023 year of how many of each of these you have currently. So I just wanted to give you an idea of what that looks like. So you have a decent amount, especially, for you. Okay. We also have heard from our constituents that it's not only about those with college degrees, right? But it's also hard to figure out, do I want to go get a college degree? And that's a big expense. But maybe I don't want to get a college degree, or maybe college just isn't for me, right? But I still am interested in helping. So we started funding community health worker programs. And this is a newer entrance for us because we've always kind of funded downstream that more terminal degree, nurses or doctors, psychologists, psychiatrists, those kind of things. But now we're kind of starting to dip our toe in to the community health worker program, because we know that, not everyone just wants to jump right into like a 4-year degree or, an 8-year degree. Like that's kind of overwhelming for a lot of people. So we started doing this. These are the ones that are funded in Indiana. So I've listed them here, the 3. And this is working to help people just kind of dip their toe in and see if they are interested in kind of that health career and working with people in that community health worker kind of stance. Because we know that they do a lot of work on the ground, and they do help people get the services that they need, and they are an integral part of the health system. And so we don't want to leave them out. And so we are slowly working into this, and I'm really happy to see this because community health workers, have been around a very long time. So I'm really glad that they are getting their due. Because they do a lot of integral work that a lot of us can't do because we aren't those trusted community members in the field and in, on the block kind of thing. So if we can get more community health workers, I think that's a great thing to do. We also do some career development diversity programs, and I'll give you an example of what that is. So if you are not familiar with our area health education centers, and I gave you a map of how it's broken down in Indiana. There's 9 for you all here. What they are they work, one of the things they do is they work with young people. So kind of middle school, high school, to get them interested in kind of knowing about what are, health fields. And so I'd really encourage you, if you don't have a relationship with your regions, to get to know them, and we can do an introduction for you. Because they can do things like, maybe you can come and speak to them about your careers for mental health, and maybe they can come and do, a walkthrough or something like that at your organization, so they can kind of understand the importance of mental health and behavioral health. And so it'll be less scary to them, and they can learn more about the different types of behavioral health careers that are available. It's not, you don't just have to be a psychiatrist, right? There's a whole plethora of different degrees and different amounts of commitment in different college, college levels, that you can be and still participate in the behavioral health field. And so that gives them the opportunity to learn about that they might not know. And it also decreases that stigma. So I think that that can be a really good relationship with your health education centers. So if you don't have a relationship already, I would really encourage you to. We are also working to create these compacts where you would be able to go across state lines with licensures. We have done this with psychology and psychiatry already. Um, and so we are working to do the same with social work. So we wanted to let you know that we have put some money towards that in 2024. And so there's links to um, the announcements and things like that. But we wanted to let you know that we are working on that as well, because we know that, you know, those kind of things, especially with telehealth, have become very big issues to be able to work across state lines. So it is something that we're working on. If you are interested in anything rule related, policies, announcements for funding opportunities. They also include those scholarship and loan repayment information. We send out like a weekly kind of announcement, and you can scan the QR code to sign up. There's all kinds of information in there. It's not just all HRSA. She includes other things from other agencies, especially funding opportunities from other agencies as well. So if you work in any space that's rural, I would highly encourage you to sign up for this. It's free. She just sends it out weekly. If you don't like anything that's in it, you can just quickly delete it, but it is a wealth of information. If you don't know how to search for um, any kind of all government NOFOs or funding opportunities, this is how you do it. I just check the check boxes for HRSA specifically and what you would check. You could check the forecasted or posted. Right now we have about, I think it's 3 pages that includes forecasted and posted awards that are currently up there. You can see if there's anything of interest to you. But you can also just use the search box and whatever kind of keyword you want to, that would search all grants if you don't use any of these other checkboxes. And you can see what's available if you're interested in seeing what is out there to apply for. We have the clinical consultation warm line. So if you work in the area of substance use and you want a free consultation that is clinician to clinician, this is available to you. And they are professionals in the area of substance use. If you have kind of a a complicated case you just want a second opinion on, maybe someone has a lot of comorbidities and you're just like, I want to run this, by you. This is, the case I have. This is all the medication the client is on for diabetes and heart issues, and maybe they have HIV and they have all this stuff, because this is also an HIV center. But they have all these other things going on. This is a medication I'm thinking of prescribing or upping their meds to something. You can walk through them with, for this. This is a really great resource, and it's free to clinicians to use. You don't have to be a HRSA grantee to use this. These are some other workforce things for you, technical assistance available. If you need to contact me, basically you can contact me for anything. I can always try to help you out. So really, anytime you want, you can contact me. These are some of the websites I used. And this is my contact information. And yeah, just let me know if you need anything. I'm here for
Wow, that was a wealth of information. Thank you, Amanda.
no
So we
problem.
have a minute left for questions. Does anyone have any questions for Amanda?
Trying to get back to the one that says stop sharing. There we go.
Just a comment. Thanks, Amanda, for presenting this morning. And also just want to say National Health Service Corps has been such an important recruitment tool for us. And I just
Oh,
really
good.
appreciate all of HRSA's support and guidance on that.
I'm so glad that you've been able to utilize it. Thank you for sharing that. And yes,
yeah.
I see a comment about the slides. Yes, I'm actually going to see if I can just attach them in the chat, actually.
And we'll put them on our members only section as well with the recording. All those resources are there as well. So Amanda, if you want to just send that to Denise, she takes care
Oh,
of that.
sure. Yep, I will do that.
We'll get that updated. And then I see Danica, you have your hand up.
Yes, thank you, Amanda, for the presentation. I had put it in the chat. I was just wondering, are there plans for multi-state licensure for LMHCs?
I have not seen that so far. That doesn't mean it would not be in the works, but I haven't seen any funding that has come out for it yet.
Okay, great. Thank you.
Mhm.
Okay, well, thank you so much, Amanda. I do want to just wrap up with a couple things. I do want to recognize that today is World Suicide Prevention Day, and I do know that a number of you that are on help with those prevention efforts, whether it be within our schools or within our communities. So I just wanted to say thank you for your efforts around that. And then a couple save the dates just so everybody has them on their calendar. If you have not registered yet for our CCBHC and annual meeting, October 9th is in-person committee meeting. October 10th is the conference, and October 11th is a business meeting. We broke 100 yesterday. Our hotel is booked, so if you need additional accommodations, reach out to Denise. She can help you with that. But it is one that you do not want to miss. We have speakers coming from Kansas and Missouri, and hopefully one from Minnesota as well as the state. So all things CCBHC related. September 30th, I'm going to keep the open office hours for now because there's just a lot going on statewide that I would like to connect with folks on. So that is September 30th for the open office hours. October 3rd, some of you have received an invitation, and please check with your organization organization CEO if you have not, regarding the state's mental health and addictions conference, the 2024 series. The one on October 3rd is Partners in Prevention. So speaking of Suicide Prevention Day, that is going to be a session on Partners in Prevention, and we would love to have our CMHCs represented there. October 7th is the state's psychiatric hospital presentation. If you've not received that information, please reach out to me and I will let you know. And then I do want to highlight that October 8th, Cup of Joe is Brittany Kelly. Brittany is the new behavioral health administrator for the Supreme Court. And so she will be on to help us in learning more about her role in that department and how CMHCs can collaborate with that court office. So some good things happening there. And so I want to recognize our Starbucks winner is Cindy Schultz at Oaklawn. Cindy, are you still? Yay, there you are. So we'll get you that Starbucks gift card. And there were several other announcements, but we'll include those in the newsletter. Yes, you can get the info, George. I'll send that to you right after the call. But if there's anything else that you guys need, please do not hesitate to reach out. Really looking forward to seeing all of you in October. Let's raise our cups and thank Amanda. Amanda, you did it. I hope you continue to feel better. Cheers, guys. And if there's anything you need, don't hesitate to reach out. Thank you, everyone.
Thank you.